5 exercises for Meralgia Parastetica. Meralgia Parastetica is basically pain in the thigh or the side of the thigh. It's often called lateral femoral cutaneous neuralgia. That's because it's an altered sensation in the thigh from a compression on a nerve called the lateral femoral cutaneous nerve. So if you have pain in your thigh, you may have Meralgia Parastetica. So it's important to remember that, there is a physical phenomenon that's happening here, some sort of compression on that nerve, but also the amount and severity of pain that you experience is really relevant to some mental, emotional, and social factors as well. So pain is physical, but it is also other things as well. So the 3 components of Meralgia Parastetica are the lateral femoral cutaneous nerve. This is a nerve that comes out of the low back and down the front of the abdomen and the front of the leg. And so when there's compression on this nerve, then you'll get that sensory disturbance of the thigh and the side of the thigh. Most often, this is caused by a compression at the inguinal ligament. So an assessment of the inguinal ligament is important to determine if that's the cause. Quadriceps muscles originate around the inguinal ligament, and tightness in the quadriceps muscles can play a part in Meralgia Parastetica. So the orthopedic tests that are used to diagnose this are the pelvic compression test, because that brings more pressure into the inguinal ligament. But then also a lower extremity neurological exam is need to be done. As I said, this just affects a sensory nerve, so all of the sensory findings of the neurological test must be done. There's really no imaging that's useful in this condition. It's mostly the orthopedic test. Maybe ultrasound could be used to figure that out. So this slide isn't as relevant, but it's just a reminder that imaging abnormalities are normal. That even if you have scary looking stuff on your x-ray or your eye, that doesn't mean that you need to be in pain. Plenty of people have those scary findings and experience no pain. So the phase 1 Meralgia Parastetica exercises are femoral nerve flossing, the IT band stretch, and the psoas stretch. So this is done in a prone, this is done on your belly. You can also do this on your side. So basically what you're going to do is lay on your belly, prop yourself up onto your elbows. You're going to pick one foot, and then you're going to begin to bend that knee as you extend the head back, just like on the picture. So the head and the lower leg are moving towards each other. And then you want to repeat that on the other side. It's primarily used for the side where you experience pain, but it's good to do it on both sides for symmetry. Next is the IT band stretch. So find a wall or something that you can lean on, standing next to the wall, and then extend the leg closest to the wall back behind you, pretty much as far as it'll go, maybe 1 to 2 feet, and then gently lean towards the wall, leaning that hip into the wall until you feel a stretch on the outside of the hip. That's where the IT band is located. Next is the kneeling psoas stretch. So in this one, you're in a kneeling position with the knee underneath the hip, the opposite knee over the ankle, and then you gently shift your weight forward so that you can get a stretch through the front of that thigh. So the phase 2 Meralgia Parastetica exercises are the Glut Bridge with band and the Tri-Planar Psoas stretch. So after you've done the other exercises and you're feeling really confident, then you can move on to these exercises. So the Glut Bridge with band, you're on your back, your knees are bent, your feet are on the floor. There's a band around your waist, and you're holding onto that band with your hands to create resistance. Gently lift the hips up towards the sky, bringing the hips in line with the knees, and feeling the resistance of the band. You can do sets here, or you can do long holds. Next is the Tri-Planar Psoas stretch. So like the previous psoas stretch that we covered, you get in that kneeling position, and then you're gently rocking yourself forward and back, forward and back. And then we're gonna use the arms to to basically get a psoas stretch in 3 planes. So first one, as you hinge forward, extend the arm of the back leg across the body, kind of in the second picture. So you're feeling a stretch there. Again, you'll just kind of floss that back and forward, extending the arm across the body. And then the next one, you're going to go forward and you're going to extend the arm up and over. This time, it's that same arm that you were extending across your body, lifting that arm up and then hinging over to the opposite side. So the triplanar stretch is you're going back and forth, then you're getting some rotation, then you're getting some side bending. So those are the stretches used for Meralgia Parastetica. The number of reps and sets you will do will depend on you. You want to feel like you're pushing yourself, but you're not pushing yourself too hard. So sometimes it's recommended to do 3 sets of 10. That may be right for you, it may not. Also, over time, you'll want to create some variability and novelty with these different exercises, making sure that they're still serving you. And that's really what I can help you with. I've been a fitness instructor for almost 20 years now, and so I can really help you find variations to these particular exercises that are beneficial for you, so that you can really get the most out of the time that you're spending doing these exercises. So my approach is threefold: reset the system, reinforce the new pattern that's been established, and then retrain that pattern. So the reset is through adjustments or soft tissue work like massage, is through Ayurveda and improving sleep and managing stress. And then the retraining is the exercises informed by yoga. So hopefully these exercises provide benefit for you and you're getting the results that you want. If you're not feeling some benefit within the first week, then it's best to schedule an appointment with a healthcare professional who can really help you. So thanks so much for watching. I really hope that you found this beneficial, and I look forward to seeing you in the clinic.